Indeed, my man. Firstly, let me just say very, very proud of you. That is no small feat. But yes, men's health, that's what we're talking about. Now, September is Prostate Cancer Awareness Month, and the Prostate Cancer Foundation wants to make use of this opportunity to encourage more men to talk about the disease and also be aware of the importance of annual screening. Next up, we meet a very inspiring individual who has not only survived prostate cancer, but is also assisting those living with the condition. Let's take a look.
September is Prostate Cancer Awareness Month, and this particular form of cancer is one of the most common types affecting men. We met with prostate cancer survivor Ian Johnston, who shared his experience.
I first realized that I might be suffering from prostate cancer when my PSA levels were starting to rise after I noticed that in my annual checkups. The problem with prostate cancer is that you aren't aware that you're sick. You know, there's no indications to you, those physical indications that you're affected. The treatment I had after my biopsy was in consultation with a urologist and an oncologist. The treatment I had was to have the removal of the prostate. That was the best option given my particular circumstances. So the recovery period for that was 6 weeks.
Early detection is key in treating prostate cancer effectively, and support from family and friends can also make all of the difference in the process.
Ian's recovery process from the op was obviously fairly traumatic. It took us a while to get used to the fact that he had had such an invasive operation. But, you know, the doctors are specialists in that field and they do the best that they can. We were obviously very supportive in terms of family. You know, we've got 2 children who were always there. They came to visit very often. In fact, I think at that stage they were both living at home, so that was great. And just to keep us all sort of motivated and buoyant, that was a big factor.
Ian is also an active volunteer at the Prostate Cancer Foundation, who advocate for greater public awareness around prostate cancer in the hope that more education and action leads to a higher survival rate.
Men's health has been a passion for many years in my life, trying to get men to take better care of their health. So when the opportunity came up to get involved in the Prostate Cancer Foundation, it was really a privilege to actually jump on board.
The main aim of the foundation is education. Education to men of prostate cancer and all the aspects that mystify this disease. Education on the fact of the importance to have your regular checkups and how to go about that is really the critical aim of the foundation. I think when you have a scare like cancer, it's a bit of a reality check, so you have a completely different perspective on the important things, and I don't worry so much about the trivial things as much as I used to.
1 in 6 men will be diagnosed with prostate cancer, but it can be treated and cured. It isn't a condition to be feared. Instead, empowerment through education can help beat prostate cancer.
Very, very inspiring indeed. But joining us in the studio this morning to give us some more advice surrounding prostate cancer, especially for the men out there, Dr. Darren Green. Welcome back to our studio, man. How are you?
Great. Fantastic to be here. Thank you.
Cool, man. I'm glad we're talking about this because I think a lot of men kind of shy away.
They do. They run.
They run, you know. It's a clenching topic, you know what I'm saying? So let's start off with who exactly is at risk when it comes to prostate cancer.
I think a lot of people under the misconception that it's a disease of old men, and what you actually need to be aware of, the incidence is just very low under the age of 30, but certainly screening processes start from the age of 40 onwards, and the incident takes quite a big steep curve between the ages of 60 and 80 years. And that's obviously quite prevalent in our population. Other people at risk are Black African men, as well as people from the Caribbean. Although we find interesting in South Africa that 62% of prostate cancers are represented by our white and so-called coloured populations, and only about 30% to 24% actually amongst our black population locally. Interesting to look at it that way.
Indeed. So at what age should you start thinking about going for maybe your first exam?
Yes, I always say just after the age of 40, unless you have warning symptoms before that.
That's a good one. I want to know, what are there warning symptoms, discomforts? What can you experience?
We call them the LUTs.
The LUTs.
The LUTs, which stands for the lower urinary tract symptoms. And basically, in a nutshell, what they mean is you have problems with the stream. In other words, the power of the jet, when you stand in front of that loo to let go, you can imagine the power of that jet has just diminished somewhat. You also then have dribbling. In other words, not soccer dribbling, but, you know, due to that slow flow. And then frequency. You go to the loo a lot more often. You feel as if there's a massive amount of urine you need to pass, and then there's only a little amount that eventually comes out. And then nocturia. And then dysuria, painful urination sometimes, nocturia, which is urinating at night time, and then obviously, as I said earlier, the frequency as well.
Well, that is a pretty big telltale sign. But if you don't have any of these symptoms, take us through the actual exam. What can men kind of expect? Because I think it makes us a little bit uncomfortable thinking about it.
Yes, the screening test, I think there's a lot of stigma around the actual digital rectal examination, which is where your practitioner, who should be trained and skilled to understand and put you at ease, firstly, for the procedure and explain it in detail. That's obviously done with a glove and your index finger, in terms of the doctor's index finger, examining the prostate digitally for its consistency, for its size, as well as looking for certain clues on the actual anatomy of the prostate. Remember, it's the size of a walnut, which is about 2.5 centimeters long, all right, and about 1.5 centimeters wide. So, and then we obviously assess then for that with a digital rectal examination. But there are other ways of screening the prostate. And that's via a blood test, for example, where we test for a specific substance in the blood called a prostate-specific antigen, PSA.
Okay.
And that can be raised.
But I think the main thing here is get it checked. I mean, obviously, you get it checked by your doctor as well. It's not something you can do yourself.
No, not like the breast examination that women often pick up. You can't examine your own prostate.
No, let's not do it. Darren, thank you so much for giving us the advice this morning. Very, very important. Prostate cancer. Make sure that, you know, if you are in those age categories, to check your prostate and also check for those telltale signs and symptoms. We're going to be back after this ad break.